keeping, close observations on how patients are healing is critical. The other aspect is following closely the recommended postoperative instructions. Those really are intended to optimize one's healing. Once we've really kind of optimized that immediate postoperative healing and we get a nice outcome, we want to maintain those outcomes. So that's where healthy lifestyle is critical. For example, if we do a eyelid surgery to address some upper eyelid skin or a facelift surgery to address some jowling that's associated with aging, certain known factors that can accelerate skin's aging effect are known. So we want to kind of minimize those exposures: sunlight, smoking, stressors in life, and really a poor quality sleep. Those are all factors that we try to kind of optimize to help maintain your outcome. The final aspect in terms of maintaining, for our patients, we never let anyone go or officially discharge. We see patients at least on an annual basis to follow up and make sure things are stable. And if necessary, we can recommend minor procedures typically to either maintain or possibly enhance some of the post-surgical changes. So these minor things can sometimes be Botox injections, filler treatments. Lasers can sometimes be recommended for addressing some skin quality. What's been really revolutionary in the last few years are these medical devices that help skin quality, toning, and tightening of the skin. So sometimes those are good to help maintain or enhance your surgical outcomes.